As more people get vaccinated against COVID-19, more of you are reaching out to us with your questions. Dr. Mallika Marshall joins us now live. And Doctor, I know you have received a lot of vaccine questions recently. I got my second vaccine today, so let's dive right in. Pamela writes on Facebook, yes, I know somebody who was accidentally injected twice at her second COVID shot appointment. What effects could this have?
Okay, so I can't even imagine how that's possible, but she should be fine. I mean, she might have a little bit more pain at the injection site, maybe some more side effects like fatigue or headache, but actually in some clinical trials, trial participants were given higher doses as part of the study, and they didn't seem to have significantly more side effects than people who were given lower doses. So she should be okay.
All right. This next question also comes from Marcy on Facebook, who writes, I had my first Moderna shot a few days ago, and my right shoulder where I got the shot has been in a lot of pain since. Is that normal?
It is normal. You can get pain at the injection site, sometimes in the whole arm, on the arm that you had the injection put in. I have to say I had quite a bit of arm pain. It can be pretty intense, but if the pain is severe or you think there's something wrong, you're having weakness, or you think that you might have an infection at the injection site, then obviously you should see your doctor. You can try some warm compresses in the meantime.
Good advice. Sam says, I'm 62 and bedbound, and I understand the Johnson & Johnson vaccine is being used for people who can't get out for vaccines. Being bedbound, I'm already at risk for blood clots. Is it safe?
That's a great question. So these rare blood clots that have been associated with the J&J vaccine are very different than the traditional blood clots that you can get from being immobile or being bedbound, for instance, and they tend to occur almost exclusively in young women. So I would talk to your doctor, but it sounds like the J&J vaccine might be a really good option for you.
Okay, and our final question comes from Sandra, doctor, who asks, when will vaccines be available for teens 12 to 15?
Hopefully soon. The FDA is actually reviewing data from Pfizer on children ages 12 to 15, and some say that could happen as early as May. I have 2 of them in my household, and I can't wait to get them vaccinated.
Yes, I think a lot of parents feel that way right now. Dr. Mallika, thank you so much. Dr. Mallika offers her best advice, but as always, consult your personal doctor before you make any decisions about your health. And if you have a question for Dr. Mallika, there are 3 ways to reach her. Email drmallika@cbs.com, on Twitter @Mallika Marshall, or you can Facebook message her, Dr. Mallika Marshall.